Philippine Information Agency, Kapihan Na Zamboanga. Sharing with you timely, accurate, and relevant information regarding government programs, projects, and activities. Catch us every Thursday at 4 p.m. on e-media.
Buenos dias, Zamboanga. Welcome sa PIA Kapihan Na Zamboanga sa SM City Minpro. Hatid ng Philippine Information Agency, Mindanao Communicators Network, SM City Minpro, MCTV, and e-media. Mapapanood po ninyo ng live ang ating programa sa PIA Western Mindanao Facebook page and other government agencies Facebook page, including PRO9, The Northern News Flash, 1TV Philippines, Isa TV Channel 17, PCH Cable TV, and via cable televisions in Zamboanga at MCTV and e-media. Muli po, ang Kapihan Na Zamboanga program will discuss important topics that will help you make more informed decisions wherever you are. Ngayon po sa ating program, sa ating episode po ng ating Kapihan Na Zamboanga, pag-uusapan naman natin ang patungkol sa Mental Health Awareness Month. Kaya naman makakasama natin from Department of Health. Muli po, i-welcome natin sa ating programa. We have Dr. Rolando Liliental Bukoy, Medical Officer po from DOH9. Welcome, Doc.
Buenas tardes a todos.
Yun. Buenos dias po, Doc. Of course, like I mentioned, Doc, no, we will talk about the Mental Health Awareness Month. Actually, annually natin itong kinakandak or annually natin itong ino-observe, no? Gaano ba ka-important ngayon ang mental health? That's why we have this program for you to be aware and for you to take note, no, kung kumusta na ba yung ating mga programs on mental health. With that po, ano po yung current status naman po ng ating mental health in the Philippines, particularly po in Zamboanga Peninsula?
The status of the mental health in Zamboanga City in particular is cases are increasing. No? It's a good sign because people tend to open up with their mental health problems. They now seek consultation, although few in numbers because a lot tend to hide because of stigma. But we have seen an increase in number of clients seeking consultation regarding their mental health.
By you mean po na client seeking attention, they go to
They
our health
visit
centers?
their family physician, a psychiatrist, or sa health center.
So we record all of that po, yung
Yes.
ating number of patients.
Yes.
All right. So that's in the entire Pero gaya po ng nasabi ni Doc, it's increasing, no? When we think of it, parang alarming na it's increasing nga yung ating mga mental health cases. But it's also a good thing na at least, no, people are now slowly opening up. They go to their physician for them to be checked and for them to, talk about mental health concerns or something na they fear or ano po yung kanilang mga pinoproblema. That's why we also note it as a parang improvement din sa ating health system.
But a lot of things has to be done because the stigma against clients suffering from mental health is still there. So although we have seen an increase in number of cases, there are still lots of clients who do not seek help. They prefer to talk to somebody else or anybody na not sa medical field.
So that's why we have this Mental Health Awareness Month,
Yes.
no, for us to be able to inform the people, make them aware of what the government is doing, especially Department of Health. With that po, Doc, ano yung main goals natin? Like I mentioned earlier na we conduct this annually na po. So for this year, ano yung goal natin for the Mental Health Awareness Month campaign?
For this year, for 2024, the theme is to prioritize mental health in workplace because the offices notice that a lot of workers in the different agencies, government and private, they suffer silently. So it could be due to financial, family matters, any other cause of mental health, but they suffer in silence. So concentration is on these clients so that to help them open up, share what they feel, where to go, what to do, to avoid suicide and all those very not so good complications from depression, etc.
Before kasi, our focus was for the youth, no, Doc? So ngayon pala, we also parang divert our focus also. Hindi naman divert, but also focus at the same time din sa ating mga working individuals. Siguro mga young adults ba ito, Doc?
Because we have been concentrating for the past few months and years since pandemic on the youth. Because every time a student or somebody young who does, for example, commit suicide, it's front page news. So then later on we noticed that we receive a lot of complaints from the middle-aged and those workers in offices. They too are suffering in silence.
Tama po. So that's why we included them, no? Inclusive po yung ating approach on the mental health concerns. Doc, for DOH naman, how do we address yung ating stigma? You mentioned kanina there's still stigma and there are still a lot of people who suffers in silence. So how would you address this surrounding the mental health issues po in the country or in Zamboanga Peninsula?
So for example, in Zamboanga Peninsula, always remember that stigma is a worldwide problem. So, but we are trying little by little, making small steps, but sure that with such dedication that at least stigma can be eradicated little by little. First is during spreading awareness. Although we do this, there's still some resistance in some quarters. No, people are not readily open. For example, sa family, some family members would prefer to not to tell anybody because it will tarnish their family name, their name or their images. So we have these things, although we understand, but what we do is to concentrate also in far-flung barangays, because those who are not very knowledgeable or let's say lack the knowledge on mental health, they tend to, let's say, chain their children or anybody with mental problems in a certain room, lock them up and leave them there. So as much as possible, we don't like those kinds of news. So with the help of our barangay health workers, whom we trained and will again be training next year to help identify, at least start a conversation, what to ask for, then refer to the proper authorities.
Okay, tama po, Doc, no, na we also want to reach the far-flung barangays din when it terms to our campaign, sa ating campaign on mental health. How about po yung ating mga specific programs, initiatives po? Does DOH have po in place na mga improved access to mental health services like dun sa ating mga far-flung barangays?
For example, we started for the past few years, increased number of trainings for physicians, especially in the community, in far-flung barangays. We will be expanding this next year to include nurses in schools, national high schools, and other, for example, agencies of mga barangay areas, so that more people will have access to more services regarding mental health instead of just going to the health center, and sometimes, let's say, the physician is not feeling well or is not present, so they can consult to somebody else, so that services can be provided to them, especially medicines. Medicines, as much as possible, we try to procure and distribute them to the different municipalities so that medicines will be free to all of those who need them.
So, i-clarify lang natin, Doc, na itong mga medicines na ito are also free, given free
Yes,
to the
free.
people. Okay.
And what is nice is that previously, when we would distribute medicines, after a few months, they would return the medicines to us, sa office. They will tell us, Doc, wala kaming pasyente. After the pandemic, until now, we would receive a lot of letters requesting for medicines. So it's a indication that people are really visiting their health centers to seek help.
Is it advisable po ba, Doc, to take the medicine? Ano po yung nagagawa ng medicine?
The physicians who disperse these medicines are all trained under the MHGAP. And these medicines are usually given to those already who could not sleep. with, let's say, hallucinations, with some disturbances. Usually, it's the sleeping pattern that is the first thing that is affected. Then later on, they have other things that they feel.
But of course, binibigay natin ito with the physician's consent.
Consent and they are monitored.
So how about, Doc, yung ating collaboration? Continuous pa yung ating collaborations in schools and in workplaces? Gaya po ng sabi niyo yung ating mga working individuals po. Are we tapping them or visiting them po sa ating mga communities for
For
our...
this year, we only went to schools who wrote us a letter regarding lectures on mental health. We plan for next year is to expand to other schools, especially sa mga national high schools. Not only training of their nurses who are the frontliners, who the student trust, but siguro probably with the officers, the students, officers, train them at least to help disseminate mental health problems in the school.
What are the steps taken naman po to integrate yung ating mental health education into the general healthcare system?
This has been discussed by Manila. They are, especially with the rising cases of mental health, is still in discussion. They plan to integrate probably, let's say, a few hours as part of the curriculum, especially in high school, about mental health, what to do, where to go, and it's just how to overcome stress. That's the concentration. But they still haven't distributed or informed us what to do because they want it to be uniform and final. So, they still do a lot of mga workshops, etc.
Are we also conducting po, Doc, sa ating mga offices talaga, like mga government offices, may mga cases na po ba tayo na ganito na nakapag-conduct tayo sa...
Dito sa mga offices, more on lectures, not yet training sa a particular person, somebody in that particular office. He or she will be the point person that if anybody from that office will suffer from some mental issues, they will just approach that person and that person can refer the client. Yes. Wala. It's still...
but siguro it's a good idea. Yes,
exactly.
it's a good idea, Doc, no? Especially sa ating mga human resource, HR department po ng ating mga offices. Na it's a good idea na may certain person nga tayo to call to that we know, no? Para hindi, siguro yung iba na baka nahihiya din to call someone else sa mga health centers. I think that's a good idea. So, baka naman merong mga agencies then that are willing, no? I think DOH is also willing then to conduct training for
Yes.
them. Alright. So, Doc, paano naman po yung ating mga individuals po? What advice are we giving from DOH po to our individuals and families dealing with mental health challenges, especially during stressful times?
Stress is always present, no? Every day. Like for us, we know how to cope up with it, no? After a few hours, a few days, it's gone. But there are those who struggle for days, no? So what my advice there is, learn to, although it's very difficult for them to open up, some of them may not recognize that they have a problem, especially with depression. For parents, for the young ones, learn to identify the signs and symptoms that certain changes in the attitude or behavior of the student, other children, it could not only be the sign of rebellion, something deeper might be happening. So don't, as much as possible, scold them, beat them up, learn to identify it and refer. Very hard thing to do, but in the meantime, that's the only advice we can share with them.
So for Doc, from the cases that we recorded, no, what are the major factors talaga that affect their mental health issues, concerns?
One factor there is family history. Okay. If a family history later on, somebody who is perfectly, let's say, normal, he or she will experience a triggering factor, something traumatic, and that will now trigger the depression or any mental health problem he or she has. One is problems in the family. Since childhood, the child has been traumatized. Peer pressure using drugs, another problem we have. And we can also say that siguro financial problems and all those things that, example, some classmates or some people may have these certain things, gadgets, and they don't have, and like it's a pressure, and later on they cannot handle it anymore.
Can stress really cause mental health problems po, Doc?
Yes, because there are people who cannot control themselves. They don't know what to do when they are in stressful situations. Some people tend to eat a lot. Some people tend to not to eat. They start to suffer from different symptoms that if they go to the physician will be confused because from abdominal pain to headache. And if you dig deeper, it's stress at home or the workplace.
So yun nga. So isa talaga din no factor is the stress no that leads also to mental health issue. So how about po yung Doc, how do you work naman with our local government units or maybe non-government organizations to provide mental health support across different regions, different provinces?
We are coordinating closely with the City Health Office. They help us a lot because they are the implementors. So through them, we train health personnel not only from the City Health Office, also health personnel attached to the LGUs in the different barangays. Because these health workers, they're the one who know the people in their area. People know them, they trust them. So any problems in that area, they approach these health workers. So they're the frontliners. So we encourage them to tell people to seek help. Anyway, they don't have to go to the hospital immediately. Just the health center will do in the meantime.
I think, Doc, meron po tayong helpline. Is it
Zamboanga City Medical Center sa mga psychiatrists. I forgot the number because I think they're planning to have a parang line wherein where the one replying speaks in the vernacular, because previously it's in Manila, Tagalog speaking. So later on we had complaints na kung example, Doc, kung example, hindi yung bueno na Tagalog, kabar the one is in Tagalog. So
ma-express?
yes, and much better if the one answering speaks in their vernacular, because the one calling can not express freely, he or she will feel comfortable.
So is it now working po dito for
Yes,
Zamboanga?
it's in the plan to identify who will be the hiring of those individuals who will be answering the calls.
But in the future, no, maybe
Yes,
siguro,
hopefully.
in the near future na, that's in Zamboanga City Medical
Zamboanga City.
Center. So we are hoping for that. I think that's a very good idea na yun nga po. Kasi language barrier. So nagkakaroon tayo ng gaps with that, no? So I think it's helpful na kasi hindi lang naman Tagalog. Some cannot really understand Tagalog, so they can't express their feelings, no, very well, or they can express their experiences very well. So I think that's a good idea. So hopefully, it will be realized very, very soon. How about po, Doc, yung ating mga upcoming policies? Do we have upcoming policies for reforms that focused on improving mental health care?
What is upcoming is the opening of the treatment rehab center in Pasobolo. I think they plan to open it. I think the next month. They will start with an outpatient department. So later on, hopefully within this year or early next year, they can start admitting clients. So this is the first in Zamboanga Peninsula. Probably they will be opening later in the different provinces, but in the meantime, everything is concentrated in Zamboanga City. And we will be also serving people from the island barangays and provinces.
Thank you po. I think that's another good news po no for Zamboanga City sa mga residents po natin in Zamboanga City. But that does also cover po other provinces nearby po.
Yes. Because in the meantime, they refer their clients to Davao, Cebu, or Manila.
Okay. So, eto po, no, ano po yung role ng public naman in supporting mental health initiatives? I know, siguro as a friend, no, if you have a friend that suffers from mental health, what can I do for them? And ano yung ating mga support that we can give and how individuals contribute po sa spreading of mental health awareness?
Number one there is acceptance that your friend has some mental health issues. Don't make fun of it. Don't take it lightly, and know what to do, how to react. For example, if your friend is so hyper, so usually we don't advise them to drink coffee, mga soft drinks, eat chocolates, because this will keep them awake, hyper. No? Because one of the problems there, they will say is, I can't sleep. I've been slept for 2 days. So that's a sign already that something is wrong. So you cannot yet take this medicine. In the meantime, remove these things to make the client sleep. If the client cannot sleep little by little, you can already address. Very important here is acceptance. Do not make fun of the client or your friend or the patient, because it will make things worse. It will drive them away. Acceptance, then when you got their trust, you can already help them, guide them what to do next.
Also, I think first is also dapat aware sila. They're aware of that there is mental health issues and concerns in the Philippines or in the world. So dapat aware sila that there are cases na meron talagang mental health concerns.
For depression, it's not very easy to diagnose because clients tend to hide. They have a happy disposition, so you will not know that they are suffering from depression until later on.
Parang siguro isa din yun sa mga dapat nating to focus on, Doc, no? Does depression po ba differs from the mental health, or from the mental health concern doon na po parang it leads to depression?
Depression has a lot of causes. For example, if you take certain drugs, medicines, family history, number one, very traumatic event in life, and the trauma there would differ from one person to another. For example, if somebody who gets sick in the family, to us, it's just okay, somebody is sick. But to others, it's something already. Yes.
Tama po. Sige, Doc. Lastly po, Doc, what is our message now that we are observing the Mental Health Awareness Month? What is our message to the people, not only to the youth, but also to the parents, all sectors po of the community?
My advice there is to learn to accept people suffering with mental health issues. Accept them, guide them. Do not be ashamed to talk to them, or do not shame them. As much as possible, guide them on what to do. There are cases wherein you'll have difficulty, but at the back of your mind, you might be wondering that something is wrong. Do not be afraid to consult a psychiatrist or any physician to help you diagnose your patient or client.
Thank you very much, Doc. Very na insight, very useful insight po sa lahat nating mga viewers, to the public, especially this mental health awareness month that we are celebrating, observing. So with that, again, we'd like to thank our guests from Department of Health in Region 9. We have Dr. Rolando Lilienthal Bukoy. Thank you po, Doc, for
Thank you very much.
imparting your message, no, and very important po na mga tips po na that we can give to our public in terms of mental health awareness. So again, if you have concerns, issues po, we have the Department of Health. Visit your nearest health centers po for your problems, no, and they can assist you, no, yung ating mga health centers. And of course, maraming salamat din sa lahat ng ating mga viewers. Hopefully po marami tayong nakuhang mahalagang impormasyon, and magkita-kita pa tayo sa mga susunod pa nating episodes where we will discuss important topics po and that can help you, no. And with that, thank you also to the following sponsors. We have Blanca Kalintika Estetica, Zamboanga, Karimadon, Camiseta, Penguin, and Dunkin, all available here at SM City Minpro. With that po, sa ngalan pong muli ng Philippine Information Agency, Director General Jose Torres Jr. and PIA Regional Head Ms. Noemi Adaga, ito si Myra Espinosa. See you next, Kapihan. Muchísimas gracias.
Philippine Information Agency, Kapihan Na Zamboanga. Sharing with you timely, accurate, and relevant information regarding government programs, projects, and activities. Catch us every Thursday at 4 p.m. on eMedia.